What I was noticing is
Thomas is a 67-year-old female that was admitted to a rehabilitation center with a diagnosis of complete left hip replacement. She fell at home and was found lying on the ground by a neighbor. Mrs. Thomas was taken to the ER with a possible fractured hip. Upon arrival, she was seen by the attending physician, and after his assessment, he ordered an x-ray of her hip. Mrs. Thomas was taken to x-ray, and a couple minutes later, the results indicated Mrs. Thomas indeed had a hip fracture. She was taken into surgery, and her hip was replaced. Mrs. Thomas was discharged from the hospital a couple of days after surgery and is now at a skilled nursing facility for rehabilitation. Mrs. Thomas was just admitted to the skilled nursing facility and is being evaluated by the RN and the LVN. The RN is performing an initial assessment and addressing any needs or complaints. During the assessment, the RN introduces the LVN to the patient and explains the healthcare professional team that will be taking care of her during her stay in the rehabilitation center in the skilled nursing facility. The RN scans through the chart to make sure that all the doctor's orders are in place and signed. She also makes sure that all consents and privacy compliances are signed as well.
Hello, come in.
Hello, Mrs. Thomas.
Hello.
My name is Keisha. Welcome to our
Keisha.
facility. I'm the RN that's going to be in charge of your care today.
Okay.
This is Tracy. She's the LVN
Hi,
that's going to be
Tracy.
attending to all your medications and any other nursing-related care issues that you might have.
Okay.
Okay, Mrs. Thomas, after looking through your chart, I see that you just had a complete hip replacement. Dr. Smith, your attending physician here in our facility, has ordered a couple orders for your care.
He has?
Yes, Mrs. Thomas.
Okay, can you please call me Tanya?
Okay, I'll make note of that. The orders he wrote are mainly medications and physical therapy orders. I'll have Tracy come in and she'll explain the medications to you. But first, I need to place this name band on your wrist to make sure that the information that we have here is correct, and so that way when anyone comes in to take care of you, they can verify who you are, okay?
Okay.
Let me double check your name here against what we have in the chart. Can you give me your full name and your date of birth?
Tanya Thomas, November 22nd, 1940.
Good. Okay, now I'm going to go ahead and begin my initial assessment. The initial assessment is going to be a head-to-toe assessment. We're going to be checking everything. Also, when the physical therapist and the nurse's aide come in, they're going to also verify your name band and the information too, okay?
All right.
The RN washes her hands before the procedure. She closes the curtain to provide for privacy. She then proceeds on performing her head-to-toe assessment.
Okay, the first thing that I'm going to assess is going to be your neurological needs.
All right.
Okay, I'm going to check your pupils now.
The RN assesses for any neurological deficiency as well as needs. Part of her neuro assessment consists of the following: assessing level of consciousness, such as is the patient alert and oriented to person, place, and time, pupil sizes, speech quality, blink, cough, and gag reflex, any visual or auditory disturbances, and Glasgow Coma Scale.
I see you use glasses. Do you have any hearing aids or dentures?
No.
Okay, good. Do you know what time it is?
It is 2 p.m.
And do you know where you're at?
Sunny Rehabilitation Center.
It's good.
The nurse is now assessing the cardiovascular portion of the assessment. Part of the cardio assessment consists of the following: heart rate and rhythm, apical pulse, peripheral pulses, jugular venous distension, capillary filling time, Hohmann sign, edema, tropic changes, IV therapy, and any complaints of chest pain.
Okay, I'm going to check your heart rate right now. I'm going to check your pulse. Okay. Let's check this one. Good. Okay. I'm going to press on the bottom of each foot now, and I'm going to be checking to make sure that you have fetal pulses. Do you have any pain when I do this?
Yes, my left foot.
That's probably because that's where your surgical site is. Good. And I see that you don't have any swelling, which is good. Okay.
Okay.
Area. The chest pain. Does your chest hurt for any reason?
Just a little.
Okay.
The RN is now assessing the respiratory needs. Part of this assessment includes the following: respiratory rate and rhythm, quality of respirations, breath sounds, symmetry of chest excursion, cough, oxygen setting, and mode of delivery, and any complaints of any shortness of breath.
Okay, I'm going to go ahead and check your lung sounds. Can you take a deep breath for me? Again. 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 Have you had a cough?
No, but I had bronchitis before I came into the hospital.
Okay, I'll make note of that. When you're coughing, is it bringing up anything?
No.
Okay.
The RN is now assessing the patient's gastrointestinal needs and complaints. The gastrointestinal assessment includes the following: the condition of the teeth, gums, and oral mucosa, oral intake restrictions, if any, diet type and percent consumed, enteral feeding tubes, if any, bowel sounds, condition of the abdomen, nasogastric tube assessment, if any are in place, stool, amount, color, and consistency, any drains, dressing, binders, and any complaints of nausea.
Do you have any pain when I press on your stomach like that?
No.
Okay, I'm going to listen for your bowel sounds now, okay? When was the last time you had anything to eat?
I think this morning,
And when was the last time you had a bowel movement?
2 days ago.
Can you open your mouth for me? Okay, looks good.
Okay.
I see you have a Foley in place.
Yes.
The doctor has written some orders for the Foley to come out today.
And it was starting to hurt.
Good.
The nurse is now assessing the genitourinary needs and complaints of the patient. Part of the genitourinary assessment consists of the following: the amount, color, character, and odor of the urine, frequency of voiding, Foley catheter if any are in place, any bladder distension and vaginal urethral discharge, irrigations if any are in place, and any complaints of dysuria, hesitancy, or pain while urinating.
Okay, Tracy, can you come in and help me for a minute? Sure. Mrs. Thomas, we're going to be checking your skin now, okay? Tracy and I are going to roll you onto your side just so I can look at your back, okay?
All right.
The RN is now assessing the integumentary needs of the patient and any complaints. The integumentary assessment consists of the following: temperature of skin, skin and nail bed color, skin turgor, skin breakdown, restraints, if any, and any complaints of any skin issues like itching or swelling.